Adaptive lymphotropic photodynamic therapy is a new method of treatment, prevention, and rehabilitation of oncological diseases used in Onco.Rehab and based on traditional photodynamic therapy. The method is based on the double effect of the laser and photosensitizers, which are most often used as derivatives of Chlorine E6. Chlorine E6 belongs to the class of plant porphyrins obtained on the basis of chlorophyll A. The porphyria molecule is key in cell respiration. Moreover, both in plant photosynthesis and animal respiration, magnesium and iron occupy the same place in the porphyrin molecule. The more a person consumes certain magnesium salts, the less it is susceptible to cancer, and conversely, the greater is the consumption of divalent iron, as it is in meat, is a cancer-provoking factor. Therefore, one of the best strategies in the fight against cancer is the saturation of cells with useful porphyrins containing magnesium. The medication with Chlorine E6 injects into the body in three ways: intravenously, lymphotropically, and rectally. The introduced photosensitizer is concentrated inside cancer cells due to the fact that the cells use chlorine as a building material in the S phase of cell division. The more malignant the tumor process, the more active is the cell division. The higher is the concentration of Chlorine E6 in the tumor formation. At the same time, normal cells do not need tetrapyrrole rings, which are actually a part of Chlorine E6. So the redistribution of the medication from the blood to the organs almost immediately leads to the leaching of chlorines back, while the liver removes excess to the intestine. During classical photodynamic therapy, the depth of laser penetration is small, which is why it is not always possible to influence on the tumor. And with adaptive lymphotropic photodynamic therapy, the drug is injected directly into the lymphatic system of the body, which increases the effectiveness of the therapy and also helps to increase the concentration of the drug in the lymph system. At the same time, Chlorine E6 is delivered directly to the tumor through the lymph nodes. Therefore, it has the least toxic effect on the organs. Onco.Rehab uses special equipment that synchronizes laser radiation with the phases of respiration and heart contractions, taking into account special individual modulations for each patient, which results in a relay knock-on effect, and the penetration depth increases from 6 millimeters, according to other data, 3 to 4 centimeters, to 10 centimeters. The destruction of cancer cells occurs not so much by photons of the red light used, but due to a combination of all the effects caused by adaptive lymphotropic photodynamic therapy. Chlorine E6, under the action of a quantum of light, goes into an excited state and interacts with a molecule of a biological substrate, forming free radicals, molecules that provoke the oxidation process, spreading it to adjacent cells. The effect of direct oxidation on the surface of cancer cells is triggered due to the direct toxic effect of the photosensitizer itself. The excited photosensitizer also interacts with oxygen molecules in the body, which leads to the formation of singlet oxygen, which breaks the atomic bonds of cancer cells, damaging the surface of their cell membranes. Then the singlet oxygen moves on and continues to break bonds, forming new free radicals along the way. Thus, the activity of singlet oxygen complements the effect of direct oxidation and enhances the toxic effect of Chlorine E6 on cancer cells. Another huge advantage of photodynamic therapy is that it can be used repeatedly in cancer treatment. The mechanism is as follows. Cancer cells are forced to constantly consume Chlorine E6 for growth and reproduction. This is the basis for the nutrition of cancer cells, which easily absorb Chlorine E6. For us, this fact is a convenient target. Chlorine E6 is also the main component for photodynamic therapy. Therefore, even with repeated photodynamic therapy, cancer cells do not develop resistance to this method. It is important to understand that the photosensitizer itself is mainly localized in the outer membranes of cancer cells. The fact is that the tumor forms an impassable area around itself, which, like the ice, binds cancer cells and limits access to any medications and immune cells. Therefore, for better penetration of Chlorine E6 into the inaccessible environment of the tumor, special ozone therapy is used. Ozone, like an icebreaker, paves a free path for the photosensitizer as close as possible to cancer cells. After that, water from the paracellular space rushes into the inner membrane of the damaged cancer cell. The membrane is filled with water and completely ruptures under internal pressure. Fragments of dead cancer cells are quickly disposed by macrophages through venous and lymphatic capillaries. The endothelium of the blood vessels feeding the tumor is destroyed, which causes cancer cells to stop receiving nutrients, and activated platelets seal the vessels, completely blocking the blood supply to cancer cells. This effect also contributes to the further development of anti-tumor immune reactions. The use of ozone in combination with photodynamic therapy allows for a 4-fold increase in the impact on cancer cells. Laser radiation in biosynchronization mode triggers knock-on relay effect to deeply located cancer cells. Healthy cells use electromagnetic and acoustic waves to transmit signals to each other about the need to synchronize a certain rhythm of oscillations during phase soul-gel transitions. Thus, knock-on relay effect seems to restart the rhythm of movement of healthy cells, which differs from the fluctuations of cancer cells. Because of this, cancer cells cannot coordinate their rhythm with healthy ones and begin to die. Thus, the final stage of adaptive lymphotropic photodynamic therapy occurs, the natural process of cancer cell death, the apoptosis. After treatment with ALFDT, the tumor continues to shrink, leaving a space between healthy cells. When it completely dies off, healthy tissue grows in its place. The technology of adaptive lymphotropic photodynamic therapy has been patented. It was developed by the oncologist, candidate of medical sciences, Sergei Sergeyevich Kupov, together with Alexander Anatolievich Shameev, and the prominent Russian scientist, Doctor of Biological Sciences, Sergei Lvovich Zaguskin. Sergei Zaguskin developed the fundamental principles of laser technology, particularly the principles of enhancing the effect of penetration of laser radiation deep into the cell. He made these discoveries in collaboration with Nobel laureate academician Prokhorov and Vice President of the Academy of Medical Sciences of the USSR, academician Ovchinnikov. It was Sergei Zaguskin's work with these outstanding scientists, and then his cooperation with us, that laid the foundation for our success in creating and developing the technique of adaptive lymphotropic photodynamic therapy. The ALPDT technique is exclusive. It is only available at Onco.Rehab because it was developed by us in collaboration with Nobel laureate co-authors. There are no equivalents to the adaptive lymphotropic photodynamic therapy technique in the world in the form that it exists with us. Combination of laser treatment and ozone in oncology as a complicated multi-component therapy for malignant tumors is a new medical technology that is legally allowed in Russia. Adaptive lymphotropic photodynamic therapy is a safe, modern, and highly effective cancer treatment that does not affect healthy tissues. Methods of integrative oncology are 1.5 to 2 times more effective at all stages of cancer in comparison with standard therapy methods. The addition of integrative oncology to standard cancer treatment increases the overall survival rate in patients over 5 years by 49%, from 49% to 73%. Thanks to integrative oncology treatment method, 8 times more people at stage 4 of cancer step over the threshold of 15 years of the disease. Cancer is frightening due to its relapses and the threat of metastasis. Cancer stem cells are specifically involved in the mechanism of cancer recurrence. The thing is, during chemotherapy, we kill mature cancer cells. However, cancer stem cells are the precursors of new cancer cells, and they are the hardest to destroy. They often survive after chemotherapy. But photodynamic therapy and ozone are highly effective in killing cancer stem cells. For some patient categories, we also use various drugs, phytonutrients, and hyperthemia. Hyperthemia is also able to significantly enhance the effectiveness of fighting cancer stem cells. Now, take the advantages of the integrative oncology treatment. To learn more about the ALFDT method, as well as the possibilities and effectiveness of integrative oncology, please visit our Onco.Rehab website or call the clinic.